There's a lot of variety between different types of melanoma, but the variation is not well defined. You see, different melanomas can look different, but no one has quantified or measured the features that tell them apart. So we're attempting to do that using image analysis with the goal of improving melanoma classification. It's been extremely helpful because we can use the screen that covers 3 of the walls, and we can spread out the images, and we can take every feature and we can look at the feature at the different extremes and everything in between, and we can see if the programming matches up with what we see visually. Now the numbers that come out from the programming are more quantitative, but a lot of times we can tell if the algorithm is working by looking at the images. Well, right now we've trained some small data sets to look at diagnosis, but we're in the process of training a larger data set of about 350 melanomas to look at whether it can predict mutations or survival and how it compares to the classical concepts of melanoma subtype. Mm-hmm. Ultimately, we're interested in whether any of these endpoints can be useful clinically. We do think melanoma classification will be particularly important because anytime you can better classify a disease, you can often choose groups of patients who might respond better to one treatment or another, or who might have better survival than others, which can be very useful in taking care of patients.